So will asylum seekers and undocumented migrants be vaccinated? That's the question from various human rights and health activists. Acting Health Minister Mamoloko Kubai has been called out by these activists to do the right thing and make the vaccination program inclusive for all. The end goal is to have population immunity. If this does not happen, we could see more variants of COVID-19 emerging. Well, to shed some more light on this, we are now joined by Associate Professor of the African Center for Migration and Society, Jo Vearey. Jo, good afternoon to you. Thank you so much for joining us. This is such an important discussion, and I was able to look at the piece that you, with others, were able to put together for the Daily Maverick in a very strong wording that you've used there to talk about marginalized community. You talked about those members of our society that live and work on the margins of our society. That's strong because it says that by authorities, it's easy for them to fall through the cracks. Talk to us a little bit about why it was important to really talk about this group.
I mean, we've got to think about two issues. One is about individual health and what it means for individuals to be missed by our vaccination program. For example, we know at the moment that individuals who are living outside of urban areas, who are without medical, are the groups that are the least likely to have the opportunity to access vaccinations. So already we know this is a challenge with people who are left behind. One of the groups within countries, as well as South Africans, so for example, citizens who are without South African identity documents for a range of reasons, or foreign nationals who are without a passport or without an asylum seeker permit or a refugee status. And the reason we need to think about this, as I say, is for individual health and the well-being of an individual. Importantly, in the context of a pandemic of infectious diseases, for a vaccination program to work, everyone must be vaccinated. For effective, I need to make sure that everyone is vaccinated. So there's about something here about rights as well as a broad argument about this is necessary.
Yeah, I keep losing you there for a moment, but I really do want to continue because this is an important discussion. One of the arguments that you're going to get from government is that home affairs right now, as we've seen in many parts of the country, are dealing with a massive backlog. And then, of course, we've seen refugee reception centers that have been closed in many parts of the country as well. So clearly there's various departments that would need to come to the party here, not just the Department of Health.
I'm not so sure. I mean, I think we've got to separate out two key issues. One is the fact that, yes, there's a backlog at the Department of Home Affairs, and there are a range of reasons that people, South African and otherwise, are struggling. But right now, what is vaccinated? And there are ways to do that without needing to be putting people through a department system. We could be arranging, for example, for a directive to come from the acting that ensures that individuals support people who are without documents to get vaccinated. We need to ensure that there is an administrative system that will allow people to do that.
All right, now I'm gonna have to let it go because that line really giving us some trouble, and that's quite unfortunate because certainly many people living in South Africa right now are desperate to also queue up for their vaccines. But thank you so much for speaking to us.